During a time of crisis, we ask a lot of people. But one of the hallmarks of SVHC is its history and its legacy of innovations. We've done things over the years here that continue just to blow me away. And the pandemic really raised the bar for us in terms of the ideas, the thoughts, the innovations that we did to protect our patients. Our number one focus was to first keep our employees safe. Because if we didn't keep our employees safe, we wouldn't be able to keep our patients safe. And this is something I attribute to this leadership in Dr. Dobson.
First and foremost was getting personal protective equipment, the masks, the respirators, the gowns. In the early days of the pandemic, Southwestern Vermont Medical Center, like almost all hospitals in the country, was running short on respirators. How are we going to take care of patients without respirators which keep our staff safe? So we thought outside the box. We contacted a local manufacturer, Mac Molding, who retrofitted snorkel masks to serve the purpose of respirators, giving us months of supply to our staff and enabling us to take care of patients without fear, without concern that we were going to run out of these vital pieces of equipment.
We never had a shortage of PPE. I worked with nurses who would tell me that their friends in other organizations would have to wear PPE for 5 days, 6 days a week at a time, would have to save their PPE or their N95s and take them home with them to make sure that they would have sufficient PPE in the morning. Throughout this pandemic, we did not have hospital-acquired COVID. We had 154 inpatient cases of coronavirus here in the organization, but we didn't have any hospital spread.
I watched our staff closely throughout this pandemic, and their ability to bond together, to stay positive in the face of adversity. They knew that's what would lead them to success, and success is measured on patient outcomes.
The situation with the COVID experience in my family is every single one of us, all 9 of us, tested positive, and they quickly recovered from that, and not so much with me. My health continued to deteriorate. I stayed at home. I figured, like many other people, I could just beat it at home by, self-medicating and just taking it easy. It rapidly progressed. I was struggling more with breathing. My wife brought me to the hospital and dropped me off at the front door. And that was the last time I saw her for 18 days.
In the early days of the pandemic, new information on how to care for these patients was rapidly evolving, and that connection with Dartmouth-Hitchcock through telemedicine allowed our doctors and nurses to ensure they were on top of the latest news, the latest treatment, the latest diagnostics to take care of patients who were critically ill with COVID-19.
One of the things that I was told while I was in ICU is that they have this close working relationship with Dartmouth Medical Center, and they talked about telemedicine, and they showed me the equipment, the monitors, the camera, and I was told that there could be occasions where a doctor would pop up on the screen from Dartmouth and start chatting with me. And I knew from talking with my nurses and my doctors that was an important part of my care.
Nursing staff and physicians at Southwestern Vermont Medical Center have 24-hour access to the critical care team at Dartmouth-Hitchcock through telemedicine. Anytime they need to be in touch with the doctor or the nurse, they can do so with the touch of a button.
I needed that connection, and I don't know if that's standard operating procedure or not, but that's the kind of care and comforting that I received. It was overwhelming, actually, and it helped so much with the fear that was going through me at the time.
Dartmouth-Hitchcock Health's partnership with Southwestern Vermont Medical Center has been incredibly enriching for both organizations. Having the technology in place before and actually through the pandemic was not only unique but inspiring. The first patient in Vermont with COVID was diagnosed at Southwestern Vermont Medical Center. That patient actually was quite ill. So ill that we considered transferring him. Instead, we decided to use our ICU capabilities and our connected care capabilities, and we actually kept the patient in Bennington.
Telemedicine has been a great addition to our ability to care for sicker patients here at SVMC. To have that backup of an intensive care physician right on the screen, right in the room, is invaluable.
The benefits of partnership that continue to grow is our expertise in connected care.
It was a challenging time for both organizations, but working together in a collaborative way was very special and very valuable. And our community benefited from that. I think it just reaffirms the fact that they're such a critical partner for us to work with.
I feel extremely fortunate to have had the care that I had, to have been surrounded by nurses and doctors who truly cared and who made me feel important and took the time and effort on a personal level to help me with the personal struggles I was having with the loneliness and the thoughts that I may not be coming out of there. And I cannot express my gratitude any more than to say thank you, and you saved my life.
The organizational challenges that we face here were probably the greatest I've faced in my 40 years as a healthcare executive. We had people, rightfully so, were fearful for their lives. In the midst of a crisis, in the midst of a pandemic, where many organizations could freeze, we just stepped up. And we took ideas from all employees. And out of the pandemic came new stars. And again, that's part of our culture of working together and letting everyone contribute and work in a collaborative way. It's really quite remarkable. That's what really makes this a very special organization.